Hello everyone. In case you don't remember, my name is Christina Pitts and I'm an occupational therapy student at the University of St. Augustine. This is video 2 out of 6 regarding developmental milestones. Before we begin, I just want it to be noted that I am a student and not a licensed practitioner. Today I will be discussing the typical developmental sequence of activities of daily living, or ADLs for children. Activities of daily living are the occupations of self-care, including learning how to take care of one's body, such as dressing, toilet hygiene, bowel and bladder management, bathing and showering, personal hygiene and grooming, and eating and drinking. This video will include developmental milestones for dressing, toileting, and bathing and grooming. Eating and drinking will be covered in a different video since that is more in depth and starts as soon as your child is born. It is important to remember that all children develop at different rates. Throughout the video, I will be giving you some general guidelines for how most children develop dressing, toileting, and bathing and grooming, as well as some of the reasons that parents or caregivers might ask for help when it comes to their children completing these activities. Here are some general guidelines for how most children develop dressing skills. Around 12 months or 1 year old, a child is typically able to pull off shoes and remove socks. They cooperate with dressing by holding out arms and legs and pushing arms through sleeves and legs through pants. By 24 months or 2 years of age, a child is typically able to remove an unfastened coat, remove shoes if the laces are untied, help pull down pants, and find armholes in a pullover shirt. Around 2.5 years old, a child typically starts to be able to removing pull-down pants with an elastic waist, assist in pulling on socks, putting on a front buttoning jacket or shirt, and unbuttoning large buttons. By 36 months or 3 years of age, a child is typically able to put on a pullover shirt with minimal assistance, meaning they might need help with one armhole or just getting it over their head initially. Putting on shoes without fasteners. The right and left orientation may be incorrect, meaning the shoes may be on the wrong feet, but that's okay because that is age appropriate. Putting on the socks, again, they may need help for orientation of the heel that may be on top of their foot, but they might need help just bringing it back down around their heel. They should be able to independently pull down their pants. They can zip and unzip jackets once you get it started for them and the zipper's on track. They need assistance to remove a pullover shirt, but they should be able to button large front buttons. Around 3.5 years of age, a child typically starts to be able to find the fronts of clothing, snap or hook a front fastener, unzip a zipper on a jacket, separating the zipper at the end, putting on mittens, buttoning a series of 3 to 4 buttons, unbuckling shoes or belts, and they dress with supervision, so they might need help with front and back. By 4 years of age or 48 months, a child is typically able to remove a pullover garment independently, buckle shoes or belts, zip a jacket zipper, put on socks correctly, put on shoes, lace shoes, although they may still need help tying shoes at this age, and they should be able to consistently identify the front and back of garments. Around 4.5 years old, they start to be able to put belt and loops independently. Between the ages of 5 and 6, a child is typically fully independent with dressing. So they're able to do all of the above that we talked about, including tying and untying knots, closing a back zipper, tying bows, buttoning back buttons, and snap back snaps. So when to ask for help. You may want to ask for help from an occupational therapist or your primary care provider when your child has physical problems, making it hard for him or her to move his body for dressing, is not undressing herself by 4 years old or 48 months, is not putting on simple clothes like pants and socks and shoes by 4.5 years old, refuse to take part in the dressing routine, or becomes extremely upset when you try to dress him or her. Here are some general guidelines for how most children develop toileting skills. Around 12 months or 1 year of age, a child typically will indicate discomfort when wet or soiled, have regular bowel movements, and sit on the toilet when placed there and supervised for less than 5 minutes. By 18 months or 1.5 years old, a child typically urinates regularly and shows interest in potty training. By 2 years of age or 24 months, a child typically is able to stay dry for 2 hours or more, flush the toilet by self, let you know when he or she has a wet or soiled diaper, and rarely has bowel accidents. By 2.5 years of age or 30 months, your child may need reminders to go to the bathroom. They may need help with getting on the toilet. Around 32 to 35 months, they should start letting you know when they need to use the bathroom and achieve regulated toileting with occasional daytime accidents. 32 months, a child's typically able to wipe urine independently. They should start to wake up dry at night and be able to wash their hands independently. By 3 years of age or 36 months, a child typically is able to go to the bathroom independently by seating himself or herself on the toilet and go to the toilet by themselves, but they still might need help with wiping and fasteners or difficult clothing. And they may need reminders and or diapers at night still. By 4 or 5 years old, a child is typically independent in toileting, including tearing the toilet paper, flushing, wiping effectively, washing hands, and managing clothing. You may want to ask your primary care provider to see an occupational therapist if your child is extremely fearful or anxious around the toilet, has extreme emotional reactions around toileting, either at home or in public, has physical difficulties making it hard to get on and off the toilet, wipe their bottom, or manage their clothing, has unusual behaviors around toileting, such as smearing poop, has developmental delays in one or more areas, such as motor skills, speech and language, thinking skills, and social skills, or have been toilet training for months and have not made any progress. Here are some guidelines for how most children develop bathing and grooming skills. A child's interest in bathing begins before 2 years of age. Between 1 and 2 years of age, or 12 and 24 months, a child typically should enjoy bath time and want to help with washing their face, hands, and body parts. Around this age, they may resist grooming activities such as having their face washed or their teeth brushed. Between 24 and 36 months, or 2 and 3 years of age, a child typically should help with washing themselves in the tub, wipe their own face with a cloth, and wash their hands in the sink with some help. By 2 years of age, they'll typically imitate the caregivers when brushing teeth. Between 3 and 4 years of age, or 36 and 48 months, a child typically will wash herself in the tub with supervision, except with washing hair, they'll need help with that. Wash their hands and face at the sink by themselves. Brush their teeth, but need help with doing a good job effectively, and help with brushing hair and wiping their own nose. Between 5 and 6 years of age, a child will typically bathe themselves with help to fill out the tub and wash hair for safety, and they need supervision only for washing and toothbrushing with reminders. Supervision of toothbrushing continues until about age of 6. Here are some little tips to help with toothbrushing. Hand-over-hand techniques will help a child learn how to direct the toothbrush in the mouth and reach all of the teeth. A small, soft brush is easier to move around the mouth, especially if a child has a gag reflex. An electric toothbrush allows more thorough cleaning for a child who is independent with brushing. It may be too heavy for a child with weakness, though. And enlarging a toothbrush handle with a sponge rubber or adding a hook and loop strap may be beneficial for a child with weakness. It's not until 7 to 9 years of age a child should be fully independent with bathing and grooming, so knowing the appropriate depth and temperature and washing and drying self. You may want to ask for help from an occupational therapist or your primary care provider if your child has physical problems, making it hard for them to move their body for bathing or grooming, or refuses to take part in grooming routines, or becomes extremely upset when you try to do grooming activities.